Afternoon, everyone. Thanks for coming. Of course, we wish we were all in the basement of restaurant and Emmaus, but we're not. So this is the second best thing we can do. And I am very anxious. I see that she is on, and I'm very anxious to introduce you to Vicky Kissler, who's probably one of the busiest people in the city of Allentown right now. Vicky's the Director of Health for the City of Allentown. She's been with the Health Bureau for over 27 years, 14 as the Communicable Disease Manager, and 13 as the Director of Health. I'm sure that with that much experience, Vicky has an enormous amount of information which you could share with us about the state of the health, not just of Allentown, but our general Lehigh Valley, especially during this pandemic. But taking care of the pandemic, looking after the numbers of COVID is just one of the many things that Vicky does. If you get a chance to visit the website, the City Health website, you will see that there are a multitude of things that Vicky overlooks. So without any further ado, I'm going to introduce you to Vicky and have her take over. And thanks, Vicky.
Thank you. Thank you all for having me with you today. I put in the chat allentownpa.gov. That is the Cities of Allentown's website. You click on departments and you can click on health, and you can see a summary of just about everything that I can touch on for you today. Most people think that health departments have a doctor sitting in their midst and that they run medical clinics, and we do that to a limited extent. We do have a medical advisor. He is an infectious disease specialist from Lehigh Valley Health Network, and he does come to us once a month to see active tuberculosis patients. But short of him coming here that once a month, we basically have nurse-driven clinics. Other than we do also have a nurse practitioner who comes to us to see sexually transmitted disease patients who may not be able to be treated by a standing order. So we really have very few physician office hours per se. What we primarily do is try our best to fill in the gaps of the medical community, as well as to address what I'm sure you're all familiar with are the social determinants of health and the connection between those social determinants and the health outcomes of our citizens. So I could talk on, and I don't want to bore you, and I know I talk very quickly, so you can go on the website and follow these things up. But basically, we have programs like nutrition and physical activity, where we deal with encouraging people to exercise more, to eat right, to keep their cholesterol levels within normal limits. Programs like our cancer control and prevention program, which helps uninsured and underinsured women in all of Lehigh County to get pap smears and mammograms and the follow-up tests necessary if they have an abnormal smear or mammogram, done through the hospital networks without any hurdles of cost or inaccessibility. We have a childhood lead screening prevention program, which deals with children who are exposed to lead in their home environment or their school environment or their Grammy's house or wherever they happen to be, and to educate families on how to reduce the child's exposure to lead. And that gets coupled with a City Hall program that is a lead abatement program that actually assists with renovations to the home to remove that source of lead for childhood lead poisoning. We have a maternal child health program that does home visits to moms with newborns or moms with children, dads with children who have a need that can't be met by the traditional medical community. Maybe it's a failure to thrive baby and this parent just needs a couple pop-ins. Maybe it's a long-term relationship because we have a mom who it's marginal whether or not that mom truly can safely take care of that child for long-term in the home. So we have these relationships with these families. We have a refugee program where we have one of our nurses who was a missionary nurse to Tanzania. She works with a refugee population to make sure that they can be connected to healthcare appropriately, but she also helps them maintain community gardens since they're used to growing most of their food. She works with them to help them keep those community gardens going in our city so that they can augment their incomes by actually growing their own food. We have a communicable disease program. There are 65 reportable by law communicable diseases in the state of Pennsylvania. We get those reports through a national electronic data surveillance system, and we use those reports to contact every patient who gets diagnosed with one of those 65 diseases and make sure that they understand what they have, they understand how to prevent it to go into others, but that they also get any of the questions they may have about that disease answered directly to them. I apologize, I have both a desktop and a laptop, and I can never tell which camera's on me, so if you see me from the side or you see me from the front, we have a stupid setup here in the city that the mics come from one and the picture comes from another, so I'm bouncing back and forth here. We have a injury prevention program. That program is working with the heroin opioid prevention task force in the city, a suicide prevention task force in the city, as well as a safe and healthy homes adventure where we actually go to 7 different counties and we do safe and healthy home inspections in the homes, a limited number in the other 6 counties, but quite a few in Lehigh County and Allentown, where we remove the risks of children being seriously injured in their homes by actual inspection in the home to try to create a safer environment. And then we have our traditional environmental health staff, which inspect all and license all the restaurants, permit and inspect and license all the daycares, respond to all the complaints of filthy conditions, and do that within the city limits of Allentown. All of the food permits, all of the special events that involve food, even a vending machine that distributes food gets inspected by one of our staff on an annual basis, if not more frequently, if there's high risk food being distributed through that restaurant or through that vending machine. We have 36 staff that does this work. And right now, 80% of the work that we do is suspended due to COVID. And we have recently, actually this morning, made that decision. Prior to this morning, all of those activities were in full swing along with COVID. But we hit our tipping point today where we can no longer respond to the number of COVID cases coming in and maintain the traditional workflow. So we instituted our public health emergency plan, and we've now reverted back to essential services only. We're treating patients positive for TB. We're treating patients diagnosed with a sexually transmitted disease. We are immunizing children and adults. And all the rest of it has ceased other than on a complaint-based notification. If we get a complaint about a daycare or a complaint about a restaurant, we're going out. And we're investigating COVID cases, morning, noon, night, weekends, round the clock, to try to catch up. And by investigating COVID cases, that means that we have a team who contacts every person who's been diagnosed with COVID, does their complete interview and obtains their contacts, turns those contacts over to a contact tracing team who contacts and checks in daily with every one of those contacts to be sure that they have not developed a symptom and become a case themselves. And if they have, then conducts the obtaining of their contacts and continues it on to try to restrict the movement of all of those persons who are diagnosed with COVID or exposed to COVID who could potentially be communicable. And in a nutshell, that's what we're doing at the Allentown Health Bureau, what we have been doing, what we're moving into doing. We started out in March having 3 or 4 cases a week. We moved into June having a record high of 200 cases a day. And now here we are. We got 167 cases yesterday. So we're closely approaching being right back to where we started. We had 1 week that we had less than 5 cases a day for that week. That was our happy week, and that was in August. We haven't been happy since that happy week in August, but we are plugging along and doing the best we can do. And we're part of a very fragmented, as many of you will know, public health infrastructure. There are only 4 municipal health departments in the state of Pennsylvania. That's Wilkes-Barre, Allentown, York City, and Bethlehem. There are only 6 county health departments in the state of Pennsylvania. If I get it right, Montgomery County, Erie County, Chester County, Bucks County, Allegheny County, and Delaware County. Those 7 county health departments are covering their chunks of the state, and everybody else in the state is covered by the Pennsylvania State Department of Health, who traditionally has 1 nurse in an office somewhere within that county. So the state with COVID was caught very, very, very shorthanded, and they've had to recruit as quickly as they could upwards of 1,000 contact tracers and 75 nurses. So they're in a various state of hiring and training and trying to pull together a workforce to respond to this. So everybody in the state is kind of doing what they can do, but I'd like to, at this time, if it's okay with our organizers, open it up to questions. And I'm looking at all your little blocks. So if you have a face in your little block and you haven't found your little blue hand, if you wave your real one, chances are Terry or I could see you and we can go from there. Joyce, do you have a question? Okay, can you unmute?
Whoops, sorry about that. I am taking a great interest in Lehigh County government, and I'm concerned and interested in knowing what your thoughts are in the event that the Lehigh County commissioners were in a position to develop a county health department. Would that help you? Would it hinder you? Is there synergies? Is it a please help me know what your thoughts are.
That's a really good question. And many of you may realize that there were attempts several times in the past to create bi-county health departments. You need to fully understand Act 315. That's the law that creates an independent health department or a county-based health department. And that law was written very specifically years ago for how to roll out a county health department or how to roll out a regional health department. And that law is the law that provides a per capita funding to public health from the state government. So the seed money that's necessary has a city or county match that has to come from the entity that is supporting it. Why it became so complicated the last time is because Lehigh County actually has a portion of Bethlehem in Lehigh County and Allentown in Lehigh County. So it involved 2 independent health departments, as well as the uncharted waters of the rest of Lehigh County. So the effort was never made to try a Lehigh County health department. The effort was made to try a bi-county health department, which meant we had to get Lehigh County and Northampton County to agree. And the way the regional directives are written under Act 315 to get the funding is that you needed the majority of commissioners in each county to agree to any budgetary decision. Now, I mean no disrespect when I say this, but when have we ever gotten everyone in Lehigh County and everyone in Northampton County to agree on anything? So I wasn't surprised when they couldn't agree on this. Then when Lehigh County said we're going to do our own health department, it became equally as complicated because the citizens of Bethlehem would be responding to a Lehigh County health department if they were in Fountain Hill, a Bethlehem City health department if they were in Bethlehem City, a Northampton County health department if they were in Bethlehem Township. They felt that would be far too confusing. Plus, it would reduce the amount of per capita funding to the city of Bethlehem's health department. So, of course, that wasn't in their best interest to defend it. So it became a political, almost as controversial as our dividing up our political subdivisions by who represents who. So needless to say, it then got switched into the hospital should do this. And let's take all the money that public health saves the hospital every year, and let's charge the hospital to make the match. That didn't exactly work out all that well either. And part of that reason is that public health departments can't be beholden to hospitals because in many cases we regulate them in different ways. So you have to be careful who funds who and who takes care of whom in order to keep that relationship legitimately and politically clean. So when people ask me my personal thoughts on health department, just because Lehigh County has a portion of Allentown and a portion of Bethlehem in it, it doesn't mean that we could not expand public health services in some key categories. And one of those key categories is communicable disease investigation. Now, if there's 300, and I'm going to round out, 325,000 people in Lehigh County, 120 of them have the Allentown City's Health Department devoted to investigating their COVID cases. Probably 10,000 have the Bethlehem Health Bureau investigating their COVID cases. But the rest, the other 200,000, have one nurse in an office in Whitehall investigating their COVID cases, except that the state had to pull nurses working from home from all throughout the rest of the state to respond and try to help them. So we can do better than that. We have to be able to do better than that. So I think expanding the services of restaurant and daycare inspection, expanding the services of communicable disease investigation, that shouldn't be hard on a county level. We could figure out those other things as they come along. But what folks don't realize is an urban, and I know people don't always think about Allentown as urban because it's not Philadelphia and it's not New York and it's not Baltimore, but it is very much an urban environment. We don't currently do well water testing. We don't currently do campground inspection. We don't currently do seafood harvesting inspection. We don't currently do trailer park inspection. We don't currently do many of those things. Sewerage enforcement, we don't do those things at the Allentown Health Department because we don't have those things. If we expand into a Lehigh County Health Department, then automatically on day one of the expansion, those things get reverted out of the state budget and into the hands of that county health department, which means we have to be able to do the inspections and the licensure of the Jandals turkey farms and the things that currently the city of Allentown is not equipped to do. So that's why it requires additional people and additional resources, because the things that we currently do here would automatically on day one be transferred from the state's responsibility to the Lehigh County's responsibility should a health department be created. So it's a very complex process of how you transition those things together. I believe it can be done, but I believe it needs a whole lot of, I don't want to protect my own assets and I need to come to the table in a way that's best for the public. And that's often hard to get. You're welcome, Joyce. Anybody else have a question? Barbara?
Okay, I unmuted myself. Can you hear me?
Yes.
Okay. When I was growing up many years ago, my mother was actually a state health nurse in Wilkes-Barre. And they did the whole kahuna. They had a thing and she traveled, had a car, a state car. So my question is, does that exist anymore? I mean, this was back in the 50s, 60s, and 70s that she was doing this. I mean, she was a state employee, Pennsylvania state employee. Are you guys Pennsylvania state employees, Lehigh County's employees? And where is the funding stream for your health department? You know, and has it changed over the year from less federal funding, less state funding to more local funding?
Barbara, that's a fantastic question. The City of Allentown Health Department are City of Allentown employees. And the City of Allentown matches $646,000 a year of state funding that comes to us to run this health department. And how we get that $646,000 a year from the state is the fact that Act 315 always funded, and this is written back in the 50s and the 60s, always funded at $6 per capita. So you took the population of the city or the county, and Act 315 awarded $6 a head in the 50s and the 60s in order for us to run our health departments. That figure has never changed. However, Governor Corbett did change the outcome because his law team read the law and focused in on the up to $6 a head. So when he saw the up to, he cut the public health funding from the $6 a head that it had been from the 50s and the 60s to what we're receiving today is roughly $4.35 a head. So we often talk about the fact that most people in the course of a month spend more money on a Starbucks cup of coffee than we get per capita for City of Allentown residents. Federal funding isn't typically available to us because we're small. We're only 120 some thousand person city. So when we apply for federal funding, we typically lose to Philadelphia, Allegheny County, places that are bigger federally than we are. So what we've had to do is piece together categorical grants. So we have a $4 million Allentown city budget. And what happens is we get roughly $640,000 from the state of Pennsylvania that the city matches. We apply for grants from all over the place and we piece these programs together. And then the rest of the money, the city of Allentown has to contribute back in to support us. So we are always grant writing. We are always doing the best we can to bring money in. And in my 27 years here, we have never been able to increase the number of staff. We've been at 36 for 27 years. However, that is now changing because thanks to COVID, we are receiving a significant amount of money for COVID investigation. They realize we can't do it with 36 people. So we're going to be, as of November 30th, adding 4 people. So we will hit 40 people as of November 30th. And that will be the biggest increase we've had in public health staffing in the last 25 years. That money is only 2 years long for COVID investigation. So at the end of those 2 years, we either lose those 4 people or we write more grants to be able to cover their salaries. But the city has chosen to make the investment to keep a public health department. So as the costs go up, the city bears more and more and more of the burden to support us. So in exchange, we try to get more and more and more grants to be able to offset the burden on the citizens. Our grant funding has been incredibly stable because we have incredibly needy citizenry. So we're able to prove back that if you give us money to do home safety inspections or to do childhood lead poisoning prevention, we'll really do it. And we'll really show you a measurable outcome as a result. And oftentimes those funders will continue to fund you for a second round. Many of the grants come through the state from the feds. So we often apply to the Pennsylvania State Department of Health for our a little bit more of the federal funding from them, but it's totally up to them whether they give it to us or not. Other questions? I would be totally remiss if I did not acknowledge that I know Fran Durham is only a purple F, but Fran and I worked together at Lehigh Valley Hospital for years, and much of the work that she showed about working with how important prenatal care was and mother-baby work was is still important. And Pat Swan popping into her little cube there, she and I had worked together on children's issues. I still work very closely with Lehigh County's Office of Children and Youth, the Fund to Benefit Children and Youth, and a number of organizations that Pat and I crossed paths with as well. So I'm sad to say that nothing has changed. We're still plugging away on those same social issues, but it's nice to see some familiar faces that we're plugging right along.
Vicky, I have a question. Mary?
Yes.
When you talked about the lead, I've done some work with fair districts, and one of the things that came up is that we have a number of locations in Pennsylvania that have lead issues that are not too dissimilar from Flint, Michigan. And one of the reasons we don't know that is because there's a lack of inspectors to cover the 800 water systems that are in the state. Do you run into a problem with inspectors that you need outside of your offices? Do you experience that lack of inspectors from DEP?
Yes and no. and this is going to sound, well, I'm just going to say, I'm noted for just speaking my mind, so this is going to sound like me. We wish that if our children were going to be lead poisoned, they were lead poisoned through the water.
Right.
But our children aren't drinking water. Frankly, our children are drinking very, very little water. And most of our housing stock has very old pipes.
Mm-hmm.
I know that that sounds as though it could be a risk, but the corrosion in the pipe actually prevents, the hard water of Allentown actually prevents the lead from leaching.
Mm-hmm.
So although the city does, through the contract with LCA, does sporadic water testing, we don't typically find lead levels in the homes that worry us. Many families drink bottled water because they're afraid of our lead, and they don't realize that much of the water they're drinking, if you look on the bottle, is Allentown water that goes through the Nestle plant. So, you know, they're buying their own water back in a plastic bottle versus drinking it out of their tap. But we do encourage all of our families to put, you know, a filter that you can buy at Home Depot on your sink if that's where they truly believe lead is coming from. But 9 times out of, well, I should say 99 times out of 100, we have a clear source of the lead poisoning in our lead poisoned children. We can walk in with our own inspectors, not needing DEP. We passed a lead ordinance. So if a child comes up lead poisoned, a homeowner or a landlord has to let us in to look at that environment. And when we walk in and we can see the paint chipping off the wall, we can see where the child has whittled away at that paint and is consuming those paint chips. We can see the very old historic window sills and window jambs where the old-fashioned pulley window is going up and down, and how the wood is actually like eroding from the use of that window. So we can often dust wipe those areas and immediately find the lead. And if we spend enough time with those kids, we'll actually see the kids picking the paint to eat the paint. So in those cases, the remediation is extremely expensive. Think about replacing all the windows in your home, or think about replacing all the paint in your home. You know, now it has to be done, thanks to the federal government, it has to be done by a lead certified abatement contractor. That's what's tough to come by. That the lead certified abatement contractors are very expensive, and they want big jobs. They don't want a little job of a home with 3 windows. They want a big job of, you know, renovating an entire apartment place. The other kind of conception or myth is that our children that are low income are the ones that are exposed to lead only. And that comes from the fact that there's a program called EPSDT. That program requires the screening of all kids on medical assistance to be screened for lead under the age of 4. That's how we find these lead poison kids. But private insurance doesn't have that same reimbursement rate to pediatricians. So kids that are medical assistants are screened more often than kids whose parents have private pay. Yet kids who live in our HOPE, or our what people refer to as Cumberland Gardens housing projects, those projects were leveled and rebuilt to lead safe housing. So often it's not in their homes. It may be staying with Grammy in a beautiful old home in the west end of Allentown. It may be a family with middle or upper income who lives in a home that was built in the 50s. Those are where you don't have a mandate to test those children. And those are also, unfortunately, where the families have an income that's too high for the lead HUD grants to be able to help with lead remediation. So then we have a middle class working family in a beautiful home that's well taken care of with a huge bill to remediate their lead and no government assistance to help them do that. So it's a very complicated program. But we had a professor from Lehigh several years ago actually steal water out of some of the schools during sporting events and came back and said, you know, our kids are being lead poisoned in the water. And basically what happened is that the water fountains hadn't been run in a long time. And if you yourself turn your water on after how it hasn't been run in a long time, the minerals will come through your water in a higher concentration. But as a result of that, that expose that was done to the media, which really wasn't all that factual, our school district replaced every single solitary water fountain in lead screening devices for all of the water sources in the school district, which cost a fortune. So we know that during the school day, kids are getting lead safe water. And we know that the majority of times the city's testing is coming up fine for any lead source. So we really believe it's the housing stock, the condition of the housing stock and the paint used in the housing stock that allows the kids to inhale the dust. And then once they start to eat paint chips, you crave it because your brain actually starts to crave the sweet taste of the lead, and it needs to be abated in order to stop the transmission.
And at that point, when a child is found with lead poisoning, the damage is done. Is that correct? I mean, it's very hard to turn it around.
It depends on the significance of the exposure. Years ago, it used to be that if a child had a lead level of 20 or higher, this was considered a horrific exposure and kids were actually medicated and all sorts of things. Now that's changed. The CDC has gotten to the point where they're saying no level of lead is allowable and we need to action on all of them. However, it's found that with simple diet changes and removing the source of the lead, kids with low levels of lead can go down to undetectable levels of lead and that they will not have significant developmental delays. But kids who are seriously lead poisoned, they may actually have to be hospitalized and chelated to remove that lead. And there it's very difficult to undo damage that has been done. And it's not just children. We've had adults test positive if they work in battery making factories and they don't change their clothes when they come home, or if they work on gun ranges or around shells from guns on farms or things like that. Wherever lead and heavy metal exists, adults can be exposed just like children. Just adults don't usually chip the paint and eat the paint the way the children do.
Just have one more question. Would you like to see universal lead testing? I think they have it in New Jersey, don't they?
I would love to see universal lead testing, but the only way that universal lead testing will work is if all the communities accept a lead ordinance. Because what good is it to test and find if you cannot enforce the fact that it has to be remediated? In the city, if your home tests lead positive, you must remediate that lead so that the next seller or buyer or family that moves in is moving into a lead safe. We never say lead free, but lead safe environment. If you don't have that ordinance, like many of our surrounding communities do not have that ordinance, families will say, thank you for letting me know, but they have absolutely no arm or push to remove that source of lead.
Thank you. You sure have a lot of issues on your plate, don't you?
But we've had this weather and everybody says that's a good thing, but all I do is keep seeing pictures of all these people out and about with no masks on, so I don't even know if that's a good thing anymore.
I see Rochelle has a question. Oh.
You guys ask great questions. They're not easy ones either. They're great questions. Anything else?
Rochelle has the question.
Okay.
Actually, Rochelle doesn't have the question. This is her husband, Bob Elvick, Lehigh County Commissioner. To follow up on Joyce's question with regard to the health services and so forth. You had a great answer there, Vicky. Thank you very much for the background information. My question is, what do your fellow organizations in the state that do exist, the 7 county ones and the city ones, in terms of funding? Do they do some of the same grant applications, kind of things that you folks are doing as well?
They do. They all have different situations. We are extremely fortunate in the Allentown Health Bureau that we have 2 large, sound powerhouses of hospitals. So our 2 hospital networks help us tremendously. We partner with them tremendously. So they will give us, our whole mammogram program is, the mammograms and the pap smears are donated by St. Luke's and by Lehigh Valley. So we're very fortunate at the Allentown Health Bureau that our hospitals have been very generous and very willing to partner. So we don't have to go for some of the grants that like a Wilkes-Barre or a York City might have to go to, where they have to actually pay for some of those services. So some of the grants are different. Plus, some of the grants are dealing very much with rural communities. So they're looking at things like mobile vans for testing and for services, where here in Allentown, I mean, we're only 12 square miles. So for us in Allentown, we don't need those roving vans or things, because we can be across town in 5 minutes to somebody, you know, who needs us. So the different health departments have very different focuses or functions. York City had a person who passed away and bequeathed them $1 million with no restrictions that they can use to augment $1 million a year, that they can use to augment whatever public health issue their Board of Health chooses to be their focus for that particular year. So each different, you know, we don't have that in Allentown. So each different municipality has a different approach. When it comes to the counties, it's kind of fascinating to me. Northampton County has used their CARES Act money for COVID testing, and they have, you know, this constant COVID testing presence where the county is very heavily involved in that. Where in Lehigh County, our only testing availability is through the 2 hospitals. So it's, you know, it's different how each county and different how each city has approached that public health. But for the citizens of Allentown, we have become, it's fascinating to me how COVID rolled out. We have become a microcosm of the major cities. In fact, our per capita rate of COVID was far higher than Philadelphia's many times throughout the year, even though we have a far smaller population. And, you know, we figured out very quickly that one of the first things that is glaringly obvious is that 80% of the citizens of Allentown work outside the city. So they leave to go to warehouses, to go to fast food out by the mall, to go to occupations that are outside the city. Our population working in the city every day comes from the suburbs. So we have the ability to infect the people going out and to have the people who are infected from out in the high risk occupations coming in. So we were faced in a much different situation than Bethlehem was. But Bethlehem has a casino that brings in people from all over. So each different city, each different county has its own different, you know, risk or its own different kind of set of issues. And that's what the grant funders look for. The grant funders look for, what is your particular issue? What is your plan? And then how can you prove that the dollars were used to make the plan work? So we're lucky here in Allentown that it's relatively easy to measure the data enough to convince them that what they're telling us to do, we're doing and it's working. So that's, I think, allowed us to develop that relationship. We just did a large suicide prevention analysis, and it was very interesting to me. The hotspots for suicide, there are 4, are the city of Allentown, West Bethlehem, the Macungies, and the Whitehalls. 4 very, very different populations in terms of numbers of suicides. But the numbers per capita for Allentown were very low. We have a lot of citizens and we have a number of suicides. But the numbers of the rates of suicide for Albertus and for Emmaus and for those municipalities and townships were just as high, if not higher than ours. Yet most people will think that our issues, those types of issues, are city issues. And then we compared that to our heroin and opioid overdoses and found that we have a very, very large number of overdoses in the city of Allentown. But many of the overdoses are folks from the suburbs who come to the city to get the drugs and overdose in the city, but don't actually live here. So the data was very hard to like kind of separate out. So it's very interesting, the pictures sometimes that we can paint of our cities and of our counties that really don't match what most people think about our cities and our counties.
Very interesting.
Question.
Yes.
During this last week and maybe the week before, the number of cases of COVID increased in Lehigh County and Northampton. Do you have information on where and who is most increasing this?
Yep, I do for the city of Allentown. I don't for Lehigh County. I can tell you that we went in March, April, May, and June, we saw huge waves among our nursing homes, our long-term cares, factory workers, warehouse workers, and healthcare workers. And those numbers pretty much wrapped it up. The Latino population was disproportionately affected because of so many working in the warehousing and the factory and the meat packing kind of occupations. That piddled out. They closed the nursing homes to visitation. Everything kind of settled down with that. Our numbers went down pretty low. Now we've opened the nursing homes to visitation, and we have numbers again in our nursing homes. We have put everybody who was working from home back into the workplace, and now our daycare numbers have skyrocketed because they went back to work. But really, we're now seeing the 19 to 35-year-olds test positive in droves. We did not have, knock on wood, the college campus outbreaks that other places did. We had sporadic cases, but we worked diligently with those college health centers ahead of the game to ward off what Penn State had and to ward off what even Lehigh is continuing to have. And we held our own until this weekend when Muhlenberg had a bit of an uptick, and we can trace that uptick as well as 3/4 of the exposures we have now to small gatherings, either family gatherings, church group gatherings, school gatherings, football team gatherings. It's small groups of people that they know each other well, and they still maintain that they could get together because nobody takes any risks. But they leave out or they ignore the fact that somebody works outside the home and doesn't wear their mask at work, or somebody has a boyfriend and that boyfriend works in a large group, or those kind of things. And that's what we're seeing in these small gatherings, these weddings, these funerals, these get-togethers where people are with, for some reason, people feel that your family has this bubble around them and cannot infect other family members. And that is just so not true. So birthday parties, bridal showers, baby showers, that's where we're seeing the transmission. And the restaurant industry, it's very simple. If you're seated at a restaurant and you're seated at a table and you take your mask off, and your waiter or your waitress is not adequately masked, they're standing above you with a heavy droplet disease. So as they breathe, cough, or talk, and let's face it, every waiter or waitress is talking to you, it comes out of their mouth and it falls down to you because you're below them. And it's one of the reasons why restaurants pose such a risk, is that if the waiters and the waitresses are masked appropriately, then you don't have a risk. But if they're not masked appropriately, you're totally vulnerable to them breathing down on you. And it poses a risk. Plus, people sit too close together. 6 feet apart is far. If you get out those 2 yardsticks, my mother was a yardstick person. She was a seamstress with a yardstick. And if I take out my yardstick and my husband takes out his yardstick, 6 feet is much further than people think it is. And they just sit too close together.
Do you have any information on gymnasiums or fitness centers?
I do not. We ask those questions, but we do not get good answers about fitness centers or gymnasiums. Keep in mind the data that I can share with you comes from the scared. And what I mean by that is that the people who are forthcoming about where they're exposed are the people who are afraid because they just found out they were exposed. The people who are asymptomatic or mildly ill, and I'm going to make the leap that many of them are in fitness centers or are in high school or are in college or are in the 20 to 30-year-old group where they still feel they are mortal, they don't feel the need to cooperate with us. They don't feel the need to tell us anything. They don't feel the need to say that I just served dinner to the entire football team. They're very closed mouth about where they've been, who they've been with, how they've encountered other people, because they're not afraid. They think they're going to live through this without any problem. So we don't get the same forthcoming nature, and they don't want to identify their contacts because they know what that means. Keep in mind, a case is in the house for 10 days. If you share the house with the case, you're in for those 10 days because they keep exposing you, and then starts your 14. So if I identify my boyfriend as a case, he's in the house for 24 days. And if I don't want to be away from him for 24 days, I'm not telling you he exists. And that's why it's difficult to get some of that information. Our younger people just do not tell it like it is. We figure it out because they can't stop putting it on Facebook. So if we look, we can see the party, we can see the gathering, we can see the football team. But they think we were born yesterday and that we haven't figured out how to connect the two. But they don't tell us that they've been at the gym.
We have time
Thank you.
for one more question. See,
Thank you for taking a second question. When you're talking about contact tracing, I was reminded about these telephone apps that we have on our cell phones. And I was wondering if you could comment on how effective they are, if they're, I mean, I have mine because I'm at risk, you know, I have comorbidities on my phone. But I don't know, can I trust it? Is it valid? Is it helpful? Please talk about that.
I was really hoping I would get through one meeting without having to, but Joyce did it.
Sorry.
Okay, you can, judging by the pictures on the phone, I can assume that you're kind of in my boat, okay? I'm a little bit old school when it comes to an app, okay? I believe in technology. I think apps are fantastic, but apps only have the information apps have programmed into them. I am a firm believer in a mask, okay? We know for years, masks are not new. And anyone who says, I don't want to wear a mask, I want them to tell their surgeon doing their surgery that he doesn't have to wear a mask, okay? Because we know that we want our surgeons masks, we want our healthcare providers masks, we want people who are dealing with us close up when it really counts to be masked. So I believe in masks, and I have data to support that mask now that we had 2 rogue hairdressers in the Midwest. Those 2 hairdressers worked when they were sick and they were masked. Their counterparts were masked. All of their patients were masked. So when they saw their 140 patients while they were sick as dogs with COVID, none of those 140 patients got COVID. And that's because everybody was masked. So in my book, a mask works. The app doesn't know if you're masked. So when you have your app turned on and you are now exposed to someone and the app tells you you're exposed, you don't know whether you were masked or whether they were masked. You just know you got next to somebody and you were within 6 feet of that somebody for 15 minutes to that somebody who had a positive test. But you don't know whether both of you were masked, whether you were masked and they weren't. So to me, although the app is useful, it implies 2 things. One is that because you're mask dinged, you're staying home for 14 days. I can't get people who know they were with somebody who exposed themselves to voluntarily stay home for 14 days. So that was the first purpose of the app. The second purpose of the app, in my mind, was to let people understand just how many times they are crossing paths with people who have tested positive. That to me puts fear into the minds of people who have been fully masked. Like if I am in the checkout line at the Giant and I'm in that checkout line for 15 minutes because it takes that long to put all my groceries on the belt and for the kid to swipe it one after another, and I know I'm within 15 minutes of him, but he is fully masked, I am fully masked, I don't want to go home worried. That app's going to tell me that that kid was a positive and that I have to worry. Now, granted, everybody says he's not supposed to be at the Giant if he's a positive, but we all know that he may not know he's a positive until after, you know, the app kicks in. And that's the other thing. You have the false assurance with the app that you're not near anybody who's positive because today they were with you. And we all know that you're exposed to them if in 2 days they test positive. So the app can't look back to 48 hours. So to me, it's a tool, but it's a tool that I have people freaking out and calling me over. And I have people ignoring because it dings all the time and they don't really know what that means. So I think the app can be useful to a degree, but I don't think it should take the place of a human. And I think if a health department calls you on the phone and says you're exposed, You need to believe them and not say, like they do to us, my app didn't go off. And then I just want to pull my hair out of my head because I'm saying, like, your kid in your classroom who sat by you said you didn't have your mask on and he didn't have his mask on. Believe me, you're exposed. And they'll say, well, my app didn't go off. So the app and I don't get along, but I do think it does serve its purpose.
Okay, I think we could go on all afternoon, Vicky. You know, we don't want to hold you up any longer, but boy, you have just scratched the surface on so many things that you are working on. I think we should all be working on getting more funding from the state. I think that would be a really good project. That's something that
we can use all the help that we can get from all of you, but you know what? I think that the groups of people like yours are the ones that have been our advocates and our partners for years. You get it, you know where we're at, you know where we're going. If this doesn't teach the state, and if this doesn't teach the counties that we need more public health than ever before, nothing should ever teach that lesson. So I am just trying my damnedest to remain optimistic that this will start those discussions, this will move those needles. But you know, it's all going to depend on whether we stick our head in the sand and it could have the other effect and say, hey, we made it through a pandemic, we don't need to do anything any different either. So you just never know, you know, where it's going to go. But I don't think this is the only pandemic. I don't think this is the only virus. I just think we're making history, and I hope that something good comes out of it in the end. But it's a pleasure to speak with all of you. I do mean it sincerely when I say you have the best questions, but they have the biggest, hardest answers.
Well, you gave great answers. You gave us a lot to think about, a lot to advocate for, I think. I want to thank you. I'm kind of overwhelmed just listening to everything you do. I want to thank you for all the work you do in the city. And I know that stretches far past the limits of the city into the whole Lehigh Valley. And we're pushing for you. We'll advocate. We'll see what we can do. But I want to thank you for taking time out of your day to answer our questions and tell us a little bit more. I think people are probably very stunned like I am that you definitely have your hands full. And we thank you for the work you do.
Well,
we really
thank you, and thanks for being patient that you booked with me and I forgot and did the old date and the new date, and I'm all over the map, but we're losing it. So we're hanging in there as much as we can. Well, thank you all.
Thank you.
Thanks again, Vicky.
All right.
Thank you so much.
Good to see you, Fran. Take care. Bye-bye.
Bye.
Okay, I'm going to turn this back over to our president, Molly Faust. And again, thank Vicky for just a tremendous presentation and answering some really tough questions. Okay, Molly.
Okay, I have just a few items of business. Membership renewals will be mailed out to you before Thanksgiving. November is our traditional time to do this. The yearly dues will remain the same with the addition of the reduced rate for those who are 35 years old and under. Our next hot topic speaker will be Chris Porek, speaking on election trends. And this is a very timely topic. You won't want to miss it. The date is Monday, December 4th, or 14th, excuse me. It's sort of late in December. And finally, in closing, let me refer to the election. What a roller coaster week it was. I hope you had a chance to read the email that was sent out on Wednesday from the National League. And I wanted to highlight some of what the letter said. It spoke of the determination of the American voter. Through a pandemic, it said, shifting voting laws, disinformation campaigns, and numerous other hurdles, voters rallied to make their voices heard in greater numbers than ever before. They further went on to write that the CEO couldn't be prouder of the role that the League of Women Voters played in ensuring voters had every option to safely cast their ballot in this unique election year. She thanked us for our dedication to our organization, to voters, and to democracy. And the head of the league remains confident in the league's future because of supporters like us. I echo her sentiments. It certainly has been a unique year for our league. But we rose to the challenge of finding ways to continue our mission of informing voters and ensuring voter access. It was a job well done. And before I head off, Mary, you said you wanted to make an announcement on, yeah. Go ahead, Mary.
I'm trying to remember what I said I was going to make the.
Oh, you were going to talk about
Oh.
Pennsylvania's legislature.
I'm sorry, it's been a tough day.
Like Hope Springs
Okay,
Eternal,
this is-
that was sort of.
Right. This is regarding fair districts and the gerrymandering, like opening up the LACRA Act to open up the process of redrawing districts. We have 2 more shots, one before the end of the session in Harrisburg, which is November 30th. They've just added a few more days onto the House calendar for voting on budget. I don't know if that'll work, but then in the beginning of the new session starting January 1st, if it's not done then, we're waiting another 10 years. So it's not too late to send emails to the Speaker of the House, the head of the Senate House Government Committee, and the House Government Committee, State Government Committee. And it's not too late to write letters to the editor. We have to give this our best shot, because if we don't, the process is going to remain the same. Behind closed doors, we have no idea of the deals going on. And what will come out of that is more gerrymandering, which you saw as a result of many of these elections, is not a good thing for Pennsylvania. We are still one of the most gerrymandered states in the nation, and we're trying like heck to change it. And I just want to echo what Molly said about doing a good job, all our voter education stuff. The county was so good in getting out news releases and things like that. It was just a total team process, and I'm also very proud of the job we did.
Okay, thank you, Mary. Perhaps I can talk with you later about sending out an email to the membership. So, all right, thank you. Enjoy the day. I appreciated you joining us, and I guess we'll, close at this point. Bye-bye.